If frontline healthcare workers have been our superheroes during the coronavirus, hospitals and healthcare facilities have been the Batcaves. Constructing new hospital wings or new buildings cost hundreds of millions of dollars and can take years. They're designed and built with the expectation of being able to last for decades. And with the coronavirus, we're learning just how big a role they play in the fight. Hospitals were always designed to treat the ill. But battling COVID-19 over the last 7 months has pushed many to their limit.
The assumption that if you get sick that we're going to have a hospital bed for you is a false assumption.
All right, let's go.
Across the country, surges in cases have forced hospitals like Chicago's Rush University Medical Center to spring into action.
The first thing we did was create a command center.
We have 11 positives.
To bring together all the different people in the organization to represent all of the potential landmines and unmet needs that we would have.
Dr. Omar Latif is president and CEO at Rush.
Then we just took a giant board and wrote down, how do we change physically this hospital so that we can take care of larger numbers of people?
That process actually started 8 years ago, long before the pandemic, when Rush added a new wing to their hospital.
When you build something for the future of healthcare, you try to build something that has flexibility or agility in it. We built an 830,000 square foot building in the city that has the ability to change airflows, the ability to double rooms, the ability to surge to 133% its capacity.
It's pretty intensive.
Former nurse Brenda Smith is a healthcare designer with Perkins & Will, the architectural firm that worked on the Rush project.
We have phases where we first are trying to create sort of a list of all of the kinds of functional spaces that they need. You look at the flow of people, both staff and patients, and you look at the flow of kind of equipment and all the things that are required to operate in that space. And some of that's been rethought with COVID as well.
Future design must also consider frontline healthcare workers, many of whom had to make hospitals their home.
People stay sometimes 15 hours, 20 hours, 24 hours, 36 hours with little breaks in between. We really need to make sure that we provide areas where they can rest.
Something else to consider? Emergency conversions, transforming everything from city parks to convention centers.
You know, we had to move very fast.
Back in April, Jason Sharor, director of health with HKS, took on the task of converting Detroit's convention center.
We have to convert non-health buildings into health buildings. That's where I think we begin to perhaps look at a diminishing standard of care, which may not give us the best outcomes.
Still, the task of repurposing spaces is nothing new.
They did temporary hospitals in the 1918 pandemic.
Historian Jeannie Kasaki says the flu presented its own challenges and solutions.
Most of the hospitals are built along the old version, the big open wards, and they are rapidly overwhelmed. After the pandemic, there's a real shift to having smaller rooms and one patient per room, or what they call one unit or one disease. So they could have 3 patients with the same disease, and they would put them in the same room.
If today's healthcare architects learn anything from their 20th century peers, it will be to take the lessons of this pandemic forward by improving our ability to respond to the next one.
So the primer here, the big lesson is?
I think the big lesson is hospitals must be designed to respond more rapidly. We're talking days and weeks, not months and years. We need to be thinking about creating pandemic preparedness in terms of flexibility, scalability, and the ability to compartmentalize infectious hotspots within hospitals. In the future, it's going to be very important for hospitals to be able to maintain, normal services during a crisis.
And it's a constant learning process. Architects, designers, healthcare workers tweaking, in real time. And it's global. I mean, peers are sharing all over the map, including folks here in the United States looking at their peers in Asia for help because they've had some really unique design elements.
Because you don't know when the next pandemic happens, whether it's a year or 100 years.
Right, and if you haven't seen something that someone else has, no way to prepare for it because you're not ahead. Great story, Michelle.
Thank you.